talking about things that affect density on your image. And we were talking about patient factors, and I believe we discussed additive and destructive diseases. Okay. So there'll be a question on your quiz next week where I will tell you this is the type of disease that they have. How would you adjust the following technique for it? And then you will have to apply those little formulas that we have. Okay. So now, other patient factors that you might have. You might have a patient who has a cast. So if you're doing an elbow, you probably, working at the hospital, would be able to come up with a technique that you could use for a person's elbow without a cast. Okay, so then what you do is you take that technique and you're going to apply these formulas to it to get your new technique with a cast. And unfortunately, there are all different kinds of casting materials out there. So you have to kind of be very good at diagnosing what type of cast that you're dealing with. So one type would be a wet plaster cast. They don't use wet plaster. No, they don't use plaster too much anymore. Yes, sir?
We went over that.
No.
I have wet plaster, double the mass.
Maybe you got it off
off
online. Did
No.
you get it out of Angel?
Well, we did.
We did not do this.
And then I got tissue opacity.
You must have worked ahead a little bit in Angel, maybe, George. That's possible.
Guess so.
Yeah. Okay, so where would you see this? This would be, if you worked in an orthopedic surgeon's office, you would do this all the time. Working in the emergency room, they'll put patients in casts, and then what they do is there will be a fracture, and they will reduce the fracture, which means that they will try to get the fracture, or maybe it was dislocated, they'll get it as lined up as best as they possibly can, and then they'll want to take another x-ray of it inside the cast to make sure that it's in the right spot. Okay, so it is entirely possible that you would do a trauma series on a patient's elbow, and then a little while later they would come back in a wet cast, and you would have to take another series of films on them. So in this particular case, if it's wet and it's plaster, you will double the mass and you will increase the KVP by 15%. You will need to do both of those things. Both of those things. So not only are you compensating for the plaster, but you're also compensating for the fact that it's wet. If you have a dry plaster cast, you will do one or the other. You won't do both. You'll do one or the other. So what they like to do is come back 3 or 4 or 6 weeks later and have another x-ray done on them before they take the cast off to make sure that it's healed properly. And then at that point, of course, it would be a dry plaster cast. Okay, so we're adding a plaster cast onto this thing. So if it's a dry plaster cast, and you had to pick one or the other, would you select mass or KVP?
Where is it? Is it chest?
It's on their elbow.
KVP.
Yeah, because you would treat it like an additive disease, wouldn't you? And the best choice would be KVP because you added something that's made that body part thicker. So we want to use KVP because KVP dictates the penetrating ability of the primary beam. Okay, so we want our primary beam to be able to get through that cast. So the best one to pick would be KVP, although you could still use mass if you so desire. All right, so we don't use plaster too much anymore, but they do like to use fiberglass. It's probably the most common cast material. And if they come over with a fiberglass cast, you are going to increase your technical factors by 30% or increase the KVP by 5%. So just by looking at those changes that you can make up there, what has a bigger impact on density, KVP or mass? KVP does, doesn't it? Because it takes a 30% change in your mass to equal a 5% change in KVP, right? Okay, so that's something that you're picking up right there is there's going to be a time when you need to adjust your film, your image, because of there's a density issue. So if you need to know how much you need to go up by, you know, there is a way that you can do it right there. And we're going to talk about that 30% and 5% here later on this morning, how to apply it to adjust your density. Plaster fiberglass, okay, so then they make this cast where the bottom of the cast is plaster. It's almost like something that they set the elbow in and then they wrap it with fiberglass. Okay, that's very, very hard to image. And so if you have a combination of a plaster and a fiberglass cast, then you'll want to go up 50% in your mass or 5% in your KVP. Or I'm sorry, 7.5% in KVP. So you'll have a question on your quiz next week where you'll have to apply those formulas to get your new technique. So what if you had this? What if I gave you a technique that was used with a plaster cast? And I want to know what technique that you would, what technique would you use without it?
You divide by whatever percent.
Yeah, instead of adding it, you would subtract it, right? So if you used, I'll just give you an example. Let's say you used 60 kVp and 10 mass with a cast, with a plaster cast. Okay. What technique would you use without the plaster cast? And let's use mass because it's easier. Okay. So a plaster cast, you will want to reduce your mass by how much? If you remove it, half. So you would use 60 kVp and 5 mass without the cast. Okay, follow me? Do you follow that? Okay, so write it down. It'll be easier. So here's your technique with the cast. 60 kVp and 10 mass with a plaster cast.
60 kVp and what?
60 kVp and 10 mass with a plaster cast. Just a regular dry plaster cast, yep. Okay, so the question is, what technique would you use without the plaster cast?
5 mass. Or how many kVp?
60 kVp and 10 mass. So the way you solve this problem is instead of doubling your mass for a plaster cast, well, you're going to cut your mass in half when you remove the plaster cast. So the new answer, the new technique would be 60 kVp and 5 mass. That would work without the plaster cast.
And it's half.
Just you're cutting the mass in half. So if you go in reverse, that new technique, 60 kVp at 5 mass, what would you use if you added a plaster cast? You would use 60 kVp and 10 mass. Okay, so you can go up or down on this. Yeah, if you add a plaster cast, you would double your mass. You go back to 10. Okay, this next section is on tissue opacity. So what we are taking a look at is just simply, we are looking at the elements that make up the different structures in the patient's body. We are looking at the elements, the atomic number of those elements. And what you have here, things that have a higher atomic number, things with a higher atomic number, they absorb more of the primary beam. Okay, so something like bone that has calcium in it, that's going to have a higher atomic number than air that would be in the fundus of the stomach. So the primary beam is going to be stopped by the bone before it would be stopped by the air in the fundus of the stomach. So that's really all this is talking about. It's just atomic numbers, and the fact that our bodies are made up of all different types of atomic numbers, that's why we have an image that shows up on the film. So